And Dr. Aloisi, would you like to introduce yourself and let them know a little bit about you?
Sure. Thank you so much. My name is Dr. Anna Aloisi, and I'm actually a graduate of this program. I graduated with my master's degree in 2010, and I'm really excited to be a part of it now as a visiting assistant professor in instruction, and I'm excited to be a part of this meeting and share some knowledge with you.
Thank you. So basically our agenda for today, we're going to kind of give you an introduction to our program, what our mission is, reasons to choose the CRM8C program, our field placement experience, licensure opportunities, careers that our program leads to, and then kind of most importantly, if you choose to apply for our program, what the application process looks like, and then we will have an opportunity to take questions at the end of this session. Okay, so our mission is kind of unique. We are considered the clinical rehabilitation and mental health counseling program, so we do look at not only mental health, but we focus on people with disabilities as well. So our goal really is to promote quality behavioral health care for all individuals, giving you an understanding of people with disabilities, mental health issues, kind of across the board, and also looking at integrated care. You know, Dr. Weinberg had mentioned that this was a very humanistic and kind of built on relationships, and that still very much is a program goal of ours. And we, have the goal as a terminal program to provide students with a solid grounding to become either certified rehabilitation counselors and or licensed mental health counselors. And so we'll talk about this kind of credentialing that our program leads to and what our curriculum is designed to help you do within the field. So we are currently a CACREP accredited program. CACREP is our accrediting body for any type of counselor education program that leads towards either, they cover clinical mental health counseling, they cover clinical rehabilitation counseling, they also have a track and school counseling in other areas. Specifically for our program, we are accredited for both clinical mental health counseling, and we also have a track in clinical rehabilitation counseling. So we'll kind of tell you about what both of those are and give you some more information on those two career paths. We do have a 50-year history in our program and have continued to build on the strengths and foundations of that program. Most recently, we are now ranked 18th in the nation as a clinical rehabilitation and mental health counseling program and #1 in the state of Florida. So we continue to really focus on our students and build the strength of our program. So if you do choose to come here, you can be assured that you will get a quality education that will prepare you for the field. There is high employment rates in this field. Definitely mental health counselors are needed. Rehabilitation counselors are both in demand. So the job opportunities are definitely out there. And oftentimes our students are either employed prior to graduation or very shortly after graduation they're employed. We do also offer, and I'm going to provide more information on this, but a unique aspect of our program is we have a couple certificate programs. So those certificate programs provide you with some specialized training in 2 different areas. We have one in marriage and family therapy. We also have one in addictions and substance abuse counseling, and I will show you a little bit more in our plan of study how those work in, and if you're interested in that kind of piques your interest, it might be something that is unique to our program that you may get here at USF versus other counseling education programs. So we offer both full-time and part-time plans. We do work with students, we do have some students that work full-time and come to school part-time. Our cohorts are mainly full-time students now. We only end up with a handful of part-time, but we do still follow that. So as a full-time student, you're going to be taking 3 to 4 classes per semester. And you'll follow a cohort plan of study. So when we talk about a cohort, we admit all of our students 1 time a year. So that's in the fall semester. So currently we're in the application cycle, which we talk about applications more, but our priority deadline is January 15th, 2026. And that will be admitted into the fall 2026 cohort. And basically you follow a plan of study that we set up very early in your program, your first semester in, you get a plan of study. And that kind of lays out what you're going to be doing. So if you follow that plan of study on full-time, we're a 2-year and 3-month. So it's fall, spring, and summer, both years, and then an additional fall. And then for part-time students, you would be taking about 2 classes per semester. And then with that plan of study, it's about 3.3 years. So 3 years and 3 months. So you'll always typically fall in your fall semester in which you'll take your internship, and that we'll talk a little bit more later about what internship looks like. But that's basically 40 hours in the field at a site placement where you're providing counseling services, and that's kind of your culminating experience of the program that you end out with. So basically our academic degrees, so we are a 60 credit program. So basically 42 core credits are required. Those are things that are required by the state for licensure as a mental health counselor or for certification as a certified rehabilitation counselor. So that's why we have so many required classes. You do get 6 credits of electives. So those electives can be taken either as certificate courses, which we'll talk about in a minute, or they can be other areas that you're interested in. So typically that's 2-3 credit courses is what most students do as their elective options. And then we have 12 credits of practicum and internships. So you take a practicum 1 and 2 that are both offered in different semesters that are 3 credits apiece. And then you do 6 hours in your final internship. And basically this ends up being 900 hours in the field. And Dr. DePippo will share more with you on the specifics regarding our field placement experience and what that looks like. If you do choose to take a certificate, so that ends up being 63 credits because it adds 1 kind of additional elective that you're taking. And when you look at the plan of study, you'll be able to see how that works. Students come in and have the option. They can either, take a certificate or not. They can be general track and just do 60 credits, or they can choose to pick up that certificate in either marriage and family therapy or addictions and substance abuse counseling, and then they would be at 63 credits. So our major concentrations, you've probably heard me say we have 2 tracks. So when you come into the program and you're applying right now, you will have the option to choose between a track. It'll say clinical mental health counseling. In your application process, it'll say clinical rehabilitation counseling, or it will be undecided. So you will kind of select what you're interested in. All we're using that doesn't tie you into one or the other. It provides us information as we're reviewing applications in the process. So if you're not certain or you don't really know what they mean, 1, ask us questions or email us. But also you can choose undecided, and we'll talk more about that through the interview process. And then if you do get admitted into the program, when we do plans of study about midway through your first semester, then we'll have a lot more information on what the tracks mean and where they lead. So in clinical mental health counseling, these are typically people who want to become licensed mental health counselors. There are 2 semesters that you take courses that are different than what a rehabilitation counseling track would take. So those are human sexuality and trauma in the family, which I'll show you in the plan of study. And it does allow for optional graduate certificates in addictions and substance abuse or marriage and family therapy, which are really an opportunity to get additional training in those specific populations. And then for rehabilitation counseling track, those are for students who are looking to become certified rehabilitation counselors. And the electives in that are rehab systems and med aspects are the 2 that students take in the rehabilitation counseling track. So the optional graduate certificates, so both of our certificates are designed the same way. They are 15 credits. And what they do is they provide 2 courses that are a part of your general track that everybody takes. And then your 2 electives end up becoming your certificate classes, so either focused in addictions or in marriage and family therapy. And then the 5th class is that extra 3 credits that you would take. So it would end up with 63 credits on your CRMHC degree. And you can kind of see the course offerings that are for the addictions and substance abuse counseling. So it's really designed for students in either the clinical rehabilitation or clinical mental health counseling if you want to understand how to work with individuals specifically with addictive disorders. And this also sets you up for an additional state-level credentialing, which is called the Master Certified Addictions Professional. And so if students are interested in gaining that additional credentialing, this gets them the content-specific training that you need to meet state requirements, and then go out and get your experiential hours very similar to licensure. Our Marriage and Family Therapy Certificate is a certificate that's designed to provide students with specific skill sets in working with couples and families. So if you're very relational oriented, have a systems perspective, and you're interested in focusing on families, couples, different things like that, this will give you kind of the broad degree of your LMHC, if you're on the clinical mental health counseling track, and then give you skill sets specifically focused on working on individuals, families, and couples. So you'll have that additional training. You can kind of see the options for the MFT certificate are, and I did just see a question, and I will answer that question while we're talking about this. So the marriage and family therapy certificate falls the same way. So human sexuality and trauma are two of the general classes that those on the clinical mental health counseling track take. And then dynamics is required, and then you get to choose from those other two electives inside the program to finish out that degree. So somebody kind of asked, could they choose both certificates? While very enticing, it's money. So one of the things that happens inside the program is the way it is designed. If you were to try to take both certificates, you would end up with additional credits that would not be covered under financial aid, because financial aid pays for any course that goes towards your degree. So the 63 credits that students take for the certificate options, if they choose one certificate option, are covered under financial aid or other aspects like that, because they all count towards your degree, because you end up choosing a track, either clinical mental health counseling or clinical rehabilitation counseling. And then if you choose a concentration is what we call it, so that would be your certificate. You could choose to pick up a concentration in addictions and substance abuse, or a concentration in marriage and family therapy, and those make those courses a part of your degree plan. So as such, then you can use FAFSA or financial aid to cover that. If you are one who doesn't mind paying additional money for the credits, then you could possibly work both in, but it's very difficult and puts you at a higher workload for the amount of classes you would have to take. That is something that if you are admitted into the program and you're interested in taking that on, you would have to meet with your advisor and discuss the pros and cons of doing something like that. Both certificates are available for students to take after graduation. So if you graduate from the program and you want to come back and get that additional training, you can always do that post-graduation. So for the CRMHC, the professional credentials that you would get for that track, the clinical mental health counseling track, or our program, so licensed mental health counselor, so that you basically need the CRMHC degree, your supervision hours, and a passing exam. I'm not going to go into the specifics because Dr. DePippo does have a slide later that talks about the road to licensure and how you become licensed in the professional credentialing. But it does lead to setting you up to become a registered mental health counseling intern with the state of Florida. Now, the one thing you'll hear us talk about a lot is if you choose to practice outside of the state of Florida, somewhere, another state, you would need to look at that state's credentialing, what their licensure requirements are, and ensure that our program can meet those requirements, because every state does things differently. And then certified rehabilitation counselor, so the rehabilitation counseling track is designed to assist with that credential. So that's the med aspects and the advanced rehabilitation counseling class that you take, help set you up to be able to take the CRC exam. And we do have some students that choose to not take a certificate, but they choose to pick up both clinical tracks. So they do clinical mental health counseling and clinical rehabilitation counseling so that they make themselves eligible or potentially eligible for sitting for CRC and LMHC. And then finally, I mentioned was the master's level certified addictions professional, MCAP. So those that do choose to take the addiction certificate will get that level of training and prepare you for state level certification in addictions professional if it's something that you're interested in doing. So our plans of study, this is what our semesters look like. This would be what a typical full-time plan of study would do. If you were part-time, we would work with you to tailor this down. So these are, our courses are offered one time a year on a cohort model. So this, everybody follows kind of the same track that's in that cohort. So what you can see on the mental health counseling track is in the first spring and second spring is where we have the diverse part of it. And I did see a question on accelerating the program. There is no way to accelerate the program. We are a 2-year and 3-month program, and you need those 2 years and 3 months really for full professional development as a mental health counselor or rehabilitation counselor. It's really needed for skill development over the time. And classes are offered in this cohort, so there is not really a way to accelerate. So our full time is 2 years and 3 months. As you can see, the classes that are highlighted in yellow, those are the 2 classes that are specific to the mental health counseling track. That's human sexuality and trauma-informed treatment and families. And then you can see the other courses that are offered as a part of our curriculum. And then the next slide will show you what it looks like for rehabilitation counseling. So for those in rehabilitation counseling track, it's the advanced rehab systems for odd years and med aspects on even years. So again, spring is the time we kind of divert off and you take your specialized track classes. And so this will give you an idea of what each semester would look like in regards to which classes you would be taking. So in the beginning, we start very content heavy, and then as we move on, as you can see in summer or second fall, you'll start your practicum and your field placement experiences, and that will continue throughout the rest of your program. So for the ASA certificate, some of the things that you can notice here, the classes that are colored are specifically for the ASA certificate. This gives you an idea of what it would look like if you chose that specific track. So generally, the ASA certificate students would take practicum. They can also take it in second fall. It's really up to the students when we do plans of study, but for summer, second fall, you start practicum. And this will show you where you fit in those classes. So starting first summer and then throughout to your next year, you'll be taking your addictions-focused classes. And the MFT certificate is very similar. So for the MFT track, human sexuality, which you take in your first spring, is one of those general everybody takes courses. And then you'll start your specific focus courses with the electives. So you would take the dynamics of marriage and family therapy in your first summer instead of taking practicum, because you would need to go ahead and start with dynamics to be able to set up to take the rest of the courses as part of the next year over that time to get your marriage and family therapy specific courses. And I'm going to hand it over to Dr. DePippo.
Okay, hi again, everyone. So field placement is built into the program structure. So as a student, you would have 3 encounters in the field. We have practicum 1, practicum 2, and then final internship. Practicum 1 and practicum 2, those are more part-time experiences in the field. And then when you get to your final internship, that is full-time in the field. We have a variety of partnerships across the Tampa Bay community that you get to choose from. I oversee the process, but it is student-led in many ways so that you can choose a setting based on your interests and also your location within the Tampa Bay area. Each spring, our program hosts what's called a field placement fair, and this is where we invite our community partners to campus, and they host a table so that you get to interact with them. You get to learn more about their agency. Our students bring their resumes to the fair and really build connections, practice professionalism, those types of things, and it helps securing your site go a little smoother for students and for agencies. As Dr. Buckles already mentioned, many of our students, because really of our high quality of training, they're employed in the field very quickly, sometimes even before graduation, which is definitely an impressive feat for them. So, and next slide. So here is how the hours are broken down. So as I mentioned, we know that you have to get 900 hours in the field. For practicum 1 and 2, the hour requirement is 150 hours over the span of the semester. So that's going to break down to where you are at an agency for 10 hours per week. That would be 15 if it's in the summer because it's a condensed semester. And then for your final internship, you would be at your site for 40 hours per week. These experiences are really critical to your development. This is where you are putting everything that you've learned in the classroom into action with actual clients. And meanwhile, you're at your site, but you're also attending a class on campus, and this is where you get your group supervision through the faculty that's teaching the course. So now we covered the 900 hours. Again, that all takes place while you're in our master's program. Then, this program sets you up to become eligible as a licensed mental health counselor in the state of Florida. So here's kind of the path to licensure. First and foremost, you would graduate from a KCREP accredited master's program. And once you graduate, you would then register with the state of Florida to become a registered mental health counselor intern. At that time, once you've registered and are approved, then you are required to obtain 1,500 direct clinical hours during a 2 years postmaster's experience. You are employed in the field, you're getting paid, all of that good stuff is in place. But the objective is to accumulate the 1,500 hours of direct client contact and 100 hours of clinical supervision. So once you graduate, that would be the next step. Once you've obtained the 1,500 hours and received the 100 hours of supervision, you are then eligible to become fully licensed as a licensed mental health counselor. During that 2-year process, you would also take a state licensing exam and a few other continuing education classes that a lot of times are online. Now, an important thing to note, I keep saying 2 years, so that's the minimum amount of time that you can accumulate those 1,500 hours, okay? So a minimum, it takes 2 years. There's no fast tracking it. And then you have a maximum of 5 years. So once you become a registered mental health counseling intern, that's when the clock starts ticking. So again, minimum 2 years, maximum 5 years to accumulate those hours. The cool thing with this degree is there is so much diversity in terms of how you can apply it, right, and career paths that you can choose. Our students work in settings such as private practice, nonprofit, for-profit agencies. We can work with all age groups, including couples and families, do individual work, group work. Additionally, you can work in vocational rehabilitation facilities. So this is really where you're helping individuals with disabilities find and maintain gainful employment. And certainly, you can also work in addictions treatment facilities, crisis stabilization units. And another cool thing is you can work with insurance companies as well. So a lot of opportunity and diversity within the field specific to this degree. So some of the things that if you were admitted to the program that you could look forward to, we have a student organization. It's called iLink, and it's free to join. It's a way to get involved with your classmates and also with faculty. Dr. Weinberg and I, we are the faculty advisors for the student organization, and they try to plan at least one event per semester, and that can be things from having a private practice panel, guests join and talk about private practice. We've done picnics, just a variety of things, and it's oftentimes based on student interest of what students would like to see. We also have a mentorship program. So students who enter our program are assigned a mentor. Assigned a mentor. that just helps them. They're a second-year student and helps share about their experience, and it's somebody that just that you can rely on, ask questions and things of that nature. Dr. Buckles already mentioned about the cohort model. So we follow that. We have small classes, at least our clinical classes are small. You can expect 10 to 12 students in our clinical classes. Our other more content-heavy classes, you have up to 30 students. And finally, we also, again, try to host events that are focused on skill building, relationship building, and really just having fun too. And then next, we have Hallie Silver, who is joining us as a second-year student to share about her experience. And she's going to touch on some of the bullet points up here and share her perspective. So Hallie, I will turn it over to you.
Hey everyone, can everyone hear me? I've never used this laptop before. Okay, okay, great. I'm actually at my practicum, my first practicum right now, taking this call. So a little bit about the application process. I'm sure y'all are in the middle of it. It seems pretty scary. I know the GRE, right, is still required, all of that stuff. But if you get the ball rolling a little bit, I'd probably recommend, if you're planning on applying for the January deadline, probably get the ball rolling on the GRE sooner rather than later. It's been shortened to, I think, 2 hours, so I think shorter than the SAT, if I'm correct. I can hear something. Okay. There's also the personal statement, and I'm honestly not that I can help write like 80 personal statements, but if people have student questions that they want answered by a student, I'll drop my email in the chat because I'm more than happy to answer anything about like personal statements, stuff like that. I know that's pretty stressful. I think probably the personal statement for me was the most daunting. But just what is it? Someone taking similar MBA programs? No, I'm not sure about that. But yeah, so if you have any questions about maybe like personal statement stuff that I can answer in like very short, feel free to reach out to me. Site placement was also very daunting. I think this whole thing seems pretty daunting, but I can't believe I'm already halfway through the program. I feel like I started yesterday. Site placement went pretty smoothly. You essentially reach out to a few places. I mean, you can reach out to as many as you want. But for me, I reached out to like 3 that I was very interested in, and I ended up setting up an interview with the one that I really, really wanted, which isn't always the best. You kind of want to have a few options. You don't want to put all your eggs in one basket. But I did end up getting the one that I interviewed with, which is where I'm at right now. I'm at Pace Center for Girls, which I love. And sorry, I'm also trying to read the chat at the same time. But yeah, so I love it here. A lot of people, but not everyone, you can stay at the same site if they'll have you back for your second practicum. So that kind of alleviated some of my stress, knowing that I really enjoyed my site and that I wanted to stay for my second practicum. And if I wanted to stay here for my internship, I'm sure they would have me, but I get to do a rehabilitation internship because I'm on the mental health counseling track as well as the certified rehabilitation counseling track. And because I'm on the RSA scholarship, which I don't think is being offered right now, I have to do my internship at a rehabilitation site. Career preparation. I mean, I feel already so prepared, and it's only been, I guess, a little bit over a year that I've been in this program. The faculty are just so helpful. You have your advisor, but you can pretty much, I don't want to say go to anyone because like you do have your advisor, but no one's going to turn you away at their door if you have like something specific to, you know, maybe what they teach or what they specialize in. Supervision assist. Okay. Supervision assist, did you touch on that at all, what it is? No. Okay, supervision assist is essentially where you just log all of your hours for practicum 1, practicum 2, and internship. At first, the interface kind of seems complicated, but it's really not. It keeps all of your hours. So, like, after my practicum today, I'm going to go home, and I'm going to say how many indirect hours I did, which could be, like, observing another counselor, right? Then I'll also log my direct hours, which was how many hours I counseled girls today. I'm saying girls because this is an all-girls school. Then faculty support and mentor support. I am a mentor, like I said, or like it was already mentioned that everyone gets assigned a mentor. You can obviously reach out to them, but like if you meet someone in an older cohort that you feel connected to, you can always reach out to them. Everyone's so nice. I'm sure y'all can kind of figure out based on the profession that we're in. No one's really going to be like, nope, you're not assigned to me, so I'm not going to answer your question. We're all helpers. We all want to help. We want to help each other. So like I said, that's why I put my email in the chat. And then, yeah, like for faculty, or I guess that was mentor, but faculty support, like I already previously mentioned, that no one's going to turn you away. If there's a certain faculty that maybe is working in the career or has worked in the specific population that you want to work to, then you can obviously reach out to them. And we're just we're a cohort, we're a program of helpers, and never be apprehensive to reach out to someone, because everyone essentially wants to help, and we got to keep the qualified mental health counselors coming through this program, so everyone would pretty much be happy to help any way they can. Did I touch on everything?
That was wonderful.
Okay.
Thank you.
I mean, I didn't see those bullet points ahead of time, so that was like a surprise. That was fun.
Yeah, you nailed it. You kind of talked about everything on there. So I'll kind of go into the application process, the timeline. When can we take the GRE? So you can take it at any time. I would encourage you to take it sooner than later. The reason why is, like, whenever I'm taking a test and it's dependent on, how I do and things like that, I want the opportunity to take it again in case I don't do the best that I think I can do, right? It just happens. So, I always encourage students to take it November. That gives you plenty of time to get your results back and then decide, all right, I'm happy with my score, or I need to take it again. So basically, our application process is all housed within the USF website. It's at that link right there. So usf.edu/RMHC. And again, that is your opportunity to decide the track that you want to do. You click on the in-person CRMHC, and then you do apply and apply now. You create a profile, and within that profile, you'll basically construct all of your materials. There'll be a little spot in there called your workspace, and that will be kind of your cheat sheet of where you have your different requirements. So like your resume, your personal statement, your recommendations. I think one thing that I always tell students to do is, yes, people love giving you recommendations, but give them something to talk about. Like, they're selling you. So, have them have some bullet points, send that to them, tell them a little bit about the program and why you're excited. They love to see that, and I think that's one opportunity that oftentimes students forget about. So there you go. So these are the requirements. So as Dr. Buckle said in the chat, you do have to do the GRE, and for it to be a complete application, that has to be submitted as part of it. You'll also do your resume and a personal statement, and you'll submit transcripts, 3.0 with a statistics course. Again, I always say that we don't use AI, we use 2 eyes. So every application we actually go through as a program, we look at that, we discuss as faculty and administrative members and things like that, and then we, if we like what we see and you complete the requirements and do the background forms and pay your application fee, which is $30. And it's been that way since I've been at USF, so that's one thing they kind of remained the same, so that's kind of nice. And then if we like what we see, then we offer you an interview space. And we have this on campus. We do offer limited availability online. We've done that in the past, but what we really encourage is that you come to campus, and here's why. We want to make sure that it's a good fit for you, right? Like, you want to see campus, and it's alive, and people around, and what it's all about, and what's USF, and, you know, if I'm driving into campus, what does that look like, and what does that feel like? And you really can't do that when you're on a Zoom or a Teams. It's just a totally different experience. Plus, we like seeing you guys. So that's my pitch a little bit. And then, you know, then we send our decisions to you. Some will be immediate, some based on availability. So as people get accepted and then they decide between us and other programs, one or two maybe open up a little later. So just kind of keep an eye out for our decisions and put your best foot forward by meeting that priority deadline. And here's a little bit about our metrics. So we're planning to admit around 40 students for fall 2026. The GPA, the minimum is 3.0. The ideal is about 3.5. I believe the last cohort, it was even a little bit, it was right around 3.7 if I'm remembering correct. And then for the GRE, around the 50th percentile in your verbal and math scores, and then your writing scores, the minimum is a 3, but ideal is 4 plus. And then, you know, statement of purpose, recommendations, and all of that is kind of taken into account. So, you know, speak to those that are giving you a recommendation. It is something where it sends them an email. So a lot of times when you're asking for a recommendation, just let them know that they'll be getting the email from USF. If they aren't used to it, it may be something where, you know, put it on their safe sender list and things like that. And then you can also add any materials to the workspace in the application. If you're having any trouble, that's kind of what I'm here for, is if you're having any application issues, things like that, reach out, and I can put my email in the chat. And then I sent out the welcome packet to all you folks, so you should have that. I will send that out again along with the recorded version of this, and this recorded training will also be available on our website. And again, January 15th, that's our priority deadline. So we have a few different options. You know, one of the best things about USF is we are rated as one of the best value universities. That's why we get a lot of out-of-state folks. You can see even for out-of-states, right, around 877.17, in-state 431.43. If you're not sure which one you fall under, go to our register office and look to see residency requirements to see which one you fall under. scholarships are available on our website. If you go to USF Financial Aid, USF offers specific scholarships. Those usually open up in December, and they use something called Award Spring. I really like that interface because you do one application. It takes all of your data that's in the system and selects you for the scholarships that are available. And then also on the financial aid website, there is another place that if you see it, it says other scholarships, and those are like the fast web and different things like that. And those are on a rolling deadline. So you could apply to a lot of those right now. It just requires a little bit more heavy lifting. You have to actually look at the different ones. You have to go to the College Board website. You have to see, am I a good fit for this, and things like that. And then, USF, if you're an employee, offers employee benefits that covers up to 6 credit hours. We currently don't have any graduate assistantships or TA assistantships, but the university as a whole may offer that. So that is something to always keep a eye out for, and it's always changing because it's based on the funding availability. So as you're starting to go through the program, ask your professors and different folks. We're a research R1 university, so a lot of them are doing research and are there to help you. That's a little bit about what we have. And then I guess, wow, I feel like we really went right through it. But this is kind of your time for questions.
So I just want to take a couple that I haven't or I know have come up. If you're a USF undergrad or you've applied to USF, we will have your transcripts in the system. So we can access USF transcripts. So you won't have to do an additional kind of list on requesting the transcripts. One person asked about like what theories and stuff we do. We teach basically all the common theories. You're going to get that in skills and techniques. You're going to get it in counseling theories class. You're going to get it in your practicum classes when we talk about what theory you're applying. We cover everything from humanistic perspectives to constructivist perspectives, narrative, feminist, CBT, Gestalt, Adlerian, all of the major theories we cover. If you're wanting specific treatment approaches, you can always find a site that specifically focuses on those kinds of things, because your site placement is also an opportunity where you're going to be applying those skill sets. So if you have something that you're specifically interested in, then you can, focus on a site that would give you that type of skill training. And then basically, just to kind of give you an idea of what we do on the interview process, the things that we do is we review your GRE scores, we review your GPA, we review your purpose statement. All applications are reviewed prior to making a determination as to who will be brought in for an interview. Our interviews are currently held through Teams, so they are remote. You are interviewed with 2 faculty members, so you will get to meet with individually 2 faculty members for about 30 minutes in an interview process. And then we come back together as a group and we make recommendations for admissions, which are then reviewed by the program director. And if accepted, then we pass them up to the graduate university. You will know, so we will start reviewing applications January 15th. And those are applications that are complete, so that does mean your GRE score, your GRE waiver needs to be in there. The statistics course does not have to be completed at that point in time. It just has to be completed prior to entering the program. But everything else does have to be there. We review those applications, and we start sending out invites for interviews. And then shortly after your interviews, we do interviews generally through the end of February, and then by the time we've gotten there, we send out an email that basically lets you know if you are being extended an offer of admission, and if you're, and then you have a certain deadline to then accept that offer of admission. So that's kind of how that process goes. I know I see there's still a few questions coming in, it looks like. So our classes are offered at different times. There are generally night sections offered, but you cannot be guaranteed a time that you want. So make sure that you know that when you come into the program, there is some variability. We do tend to try to offer a day section and an evening section as a run-of-the-mill kind of process. That is not always possible due to faculty availability, room availability. All of that goes into play in determining. So I can't tell you you'll absolutely always get an evening class or it'll absolutely always be an afternoon or morning class. Our days sometimes are in the morning, which is generally, you meet one time a week. So all classes are held for 3 hours in that kind of 3-hour block. And we do meet one time a week. So we have designed our program where classes meet one time a week rather than like an undergrad where you might have met Monday, Wednesday, and Friday or Tuesday and Thursday. So typically if you have a class on Tuesday, it's going to be on Tuesday, and that's the only time you have that class during the week. And in the morning sessions, it runs from 9:30 to 12:15, and then the afternoons are 2 to 4:45, and the evenings are 6:30 to 9:15, unless it's summer, and then that time changes a little. And I don't know if anybody wants to unmute and ask a question, you're more than willing to. I know I see there's more questions coming in the chat, so I'm trying to kind of go through that as well.
Dr. Buckles, could I speak on the job one?
Go ahead, Holly.
Yeah.
Absolutely.
Danielle asked, do you have students that take full-time course load and maintain a part-time job? There's actually students that take a full-time course load and maintain a full-time job. So yes, a part-time job is very common, especially given like our practicums are unpaid. Internships kind of rare that it is paid. So it is a kind of ideal that for a lot of people that they're working ahead of that 40-hour-a-week internship, so we're able to maybe take the 40-hour-a-week, it's not volunteer, but unpaid hours. So it says how much time time outside the classroom hours should we expect to commit to our degree. I think that's really hard to say. It's kind of, people are going to put in different amount of work, but I've always been able to, I'm a part-time tutor, probably do like 15, 20 hours a week, and I have not once, with my internship, right, or my practicum, I have not once felt like it's not able to be managed. I feel like it's definitely a comfortable workload. I think coming from where I did my undergrad at UF, I almost feel like I put in very similar hours to what I did in undergrad, which might be like around, I would say 5 hours maybe. But then again, like, you're going to have your practicum, which is going to be 10 to 15 hours a week. You're going to have your internship. And, yeah, I think that answers it.
I know there's been some questions about the GRE waivers. GRE waivers can be requested. You would need to contact Tatiana through email to request a GRE waiver and then submit your transcript and the purpose for a GRE waiver. GRE waivers, for the most part, are granted based on people who have a master's degree already and have demonstrated the ability to perform at a graduate level. We do not take work experience in lieu of a GRE because it's still about, the GRE is to measure your ability to perform at a graduate level. That is not an end-all be-all for our admissions in the program. You saw our kind of average GRE scores, so I would shoot for that. But we do take into consideration the GPA and the interview that we do, and we do take into consideration during that interview who we believe has good interpersonal skills and would do well as a graduate student training to become a clinical mental health counselor or a clinical rehabilitation counselor. And multiple applications can be submitted if you're trying to apply for other programs. The one thing that I always say with that is really think about your professional identity. Look at the curriculum of the different programs that you're applying for and see if they meet your needs or your professional development needs. Because our curriculum is very much different than social work's curriculum, which is very much different than marriage and family therapy's curriculum. So really think about your professional identity and your training, how you want to be trained and what your goal is, and that can kind of help dictate maybe where you're most drawn to applying towards. There's not a different application process for part-time. It's just in your plan of study. So once you get admitted, then we would, when we make your plan of study, you would make it something that is part-time. And I know somebody asked about what's our ideal candidate. Our ideal candidate is somebody that's personable. We're training to be therapists. So if you don't have the highest of GPAs, that's okay. We do still require at least a 3.0 GPA, and as you saw, our average GPAs are fairly high for our admitting cohorts. We have been seeing higher quality students. So we do look at your ability to perform in the class, but we also look at your ability to relate to people. So understand the field that you're going into so that you assure that this is the right process for you. We're going to ask you in that interview, how much do you know about the licensure process, if that's what you tell us you want to be, and we're going to ask you if you're prepared to know the time commitment that it's going to take to become a licensed mental health counselor. Because we don't want you to spend 2 years and 3 months in a graduate program and be set up for another 2 years as a registered intern and, you know, not know that it's going to take that amount of time to actually become a licensed mental health counselor. For CRC, that process is a little bit different because you can actually sit for the National Certified Rehabilitation Counselors exam once 75% of your coursework is done. So if you're interested in the rehabilitation counseling side, you know, please make sure that you understand rehabilitation counselors and the fields that they work in because it is a little bit different than mental health counseling, and that you understand that credentialing as well. So really we're looking for somebody who's personable, has good interpersonal skills, understands what they're getting into and what it's going to take to become a rehabilitation or mental health counselor, and, you know, can take constructive feedback as well. That's going to be a big part of this because you're going to get a lot of it throughout the program as part of just your training and development.
Can I quickly ask a question? I was just curious if you get a lot of applicants who don't have education or work background in the mental health field. So for a little background, I graduated college 6 years ago. I want to switch fields and I'm very interested in the program at USF, but does that hurt our chances when applying, and or are there ways that we can better our chances for being accepted into the program?
Great question. So the answer is yes, we have had people that come and are changing direction, and that's okay. What you would want to do is get experience in the field. That's going to be your biggest way to strengthen your application. So if you can find volunteer opportunities or mentorships or things like that that you can speak to, because you can write that in your statement to us, that will help us understand that you understand this change in direction and you have a passion for it, and you're really, and those are the things that I would speak to. So we definitely have had students who have done that. It doesn't make your application any less, you know, impactful if we look at your degree being in something else. We've had people who had master's degrees in statistics and worked as statisticians and did a 180 and said this is what they always wanted to do, and now they've come into our program. So really we take into consideration the interview, your passion, and your personal statement. That's when you get that opportunity to show us what it means to you, and that's what I would suggest.
Awesome. Thank you. I really appreciate that response.
Hey, good afternoon. Am I audible?
Mm-hmm.
Thank you so much for doing this. My name is Jay. I had a quick question about FAFSA. I wasn't sure if that is something that's applicable for graduate students. I thought it was only for undergrad.
Financial aid will pay for your graduate degree as well. Any courses that go towards your actual degree. So that's why typically it's 60 credits because most master's degrees are at a maximum of about 60. Since we do the concentration, which counts towards your degree, it's up to 63 credits in our program.
Okay. Thank you.
Mm-hmm.
The biggest difference between graduate work and undergraduate is for FAFSA-related things. I used to work in financial aid, so the biggest thing is that there's a lot more grants that are available to undergraduates, and for graduates, graduate funding, it's a lot more loan-based. I still encourage you to apply to FAFSA. A lot of the university scholarships and things like that, they take in your financial need into account, and their requirement is that you have a FAFSA on file. I recently completed my FAFSA because I'm taking graduate courses, and because I had an online profile already with the IRS and things like that, it took less than about 10 minutes. So it's not as hard as it used to be. It used to be where you had to do multiple steps and it was really tough and things like that. It's no longer that way. So it is open right now. It opened, I believe, October 15th. So while you're thinking about it, go apply and see what is offered and get some of those ducks in a row as well.
I have another. I'm sorry.
So the Bright Futures question, Bright Futures can't be used on graduate levels unless you specifically talk to them and they make an arrangement, but you would have to discuss that with Bright Futures. It's typically not used on graduate level classes. I'm so sorry. What was the question that you had?
Yes, I have a question. Good afternoon, everybody. So thank you for this training. It has been very informative. So I would like us to know, since I'm a state employee, do we have to, what is the process? Because I'm a little bit confused where to go to, how to apply to it, because I know that, right now I'm a rehabilitation counselor at DR. So I would like just to know the process about that, how I go, who I contact, because since I'm new, I didn't know. My supervisor's like, you have to contact, but I don't know where to go. I'm kind of confused right now. Like, who do I go when it's a state, when we are a state employee, who I can contact was different, or where do I go to make that application process?
I don't believe your application process is any different as a state employee. If you're wanting to use state waiver, is that what you're asking?
Yes.
So once you're accepted into the program, because it doesn't change any of that process to getting accepted, if you're accepted in the program, then once you register for courses, you will have a process with your supervisor to request the state waiver for those courses.
Okay.
But it doesn't change the application process.
Okay. Thank you very much.
I did put it in the chat, like the state of Florida employee and the different ones that it will ask. And yeah, so that is good to know because I know that was something that came up.
So there's a question about auditing courses, and I've seen it a couple times. There is no option for auditing courses. So if you're wanting to assess fit, you can take non-degree seeking classes. Now, those are not our typical CRMHC classes. Those are certificate-related classes that are available for non-degree seeking. So you could register for like an addictions class. There are very few that we do accept non-degree seeking students in, so if you're interested in trying to do that, you would need to have a discussion with myself or Dr. DePippo about what that would look like as a non-degree seeking student, but our general curriculum is not open to non-degree seeking or auditing. I know we're after 1 o'clock. Are there any last questions that anyone has? I will, if we didn't get to a question in the chat, because I know there was a lot that came in that I may not have filtered through everything, please feel free to email me or Dr. DePippo. My email address is very easy. It's just vbuckles@usf.edu. You can email Jake or Tatiana with questions as well. We appreciate everybody joining us today. And like I said, if I didn't get to a question you had, just shoot us an email and we could definitely answer it for you. And we will have another information session on December 1st, not information session, but a Q&A for applications as we get a little bit closer to the application process, so on December 1st. So if you do have any unanswered questions or things that come up after that, you will also be invited to attend that session as well, where we will be live and available to answer any questions that you might have on the application process.
Thanks, everyone.
Thank you.
Thank you.